Hello, my name is Renee Uzobihi, and this is my physical assessment assignment for NR 509.
And my name is Melvin Akosa, and I give permission for this examination to be recorded and submitted to Chamberlain College of Nursing for grading purposes.
And I will complete the environmental scan. Okay, first I will let patient know what I'm doing, and I'll be doing your physical assessment today. And I will start by looking at your face, and I don't see any discoloration and there's no lesion. And I'm looking at your head, it's midline and symmetrical. And I will palpate your lymph node. I will start in front of the preauricular lymph node, which is in front of the ear, postauricular lymph node, which is behind your ear, and the occipital lymph node at the back of the head, and the tonsillar, the submandibular, and the submental, and the anterior cervical lymph node, posterior cervical lymph node, and the supraclavicular lymph node. They all appear equal intact, and I did not notice any enlargement. Next, I will assess the cranial nerves, and I will start with cranial nerve number 5, which is the trigeminal nerve. And this nerve has motor and sensory component. And I will start with the motor component, and I will palpate the masseter bone in the face as patient clenches his teeth. Good. I don't feel any distortion. Do you have any tenderness?
No.
Good. And it's equal bilaterally. And next, I will complete the sensory part, which is patient being able to identify my touch. And can you close your eyes and tell me where you feel my hand?
Forehead, left cheek, right cheek, chin, nose.
Good. Patient was able to identify all places that I touch, and they are all equal and normal and symmetrical. Next, I'll be assessing for the facial nerve, which is cranial nerve number 7. And I'll have patient complete this series of expressions. Can you smile? Can you frown? Can you lift your eyebrow? Can you puff your cheek? Good. So far, everything looks symmetrical. And can you pucker your lips? Good. This is tight pucker. Next, I'll be checking the ear. And I will inspect the ear for any nodule or redness. Do you have any tenderness? Do you have any tenderness?
Yeah.
And I'll be using my stethoscope, and I'll be looking at inside the ear, and I will put the ear back and up, and I'll be putting the ear up and back, and I'll be assessing the external auditory canal for any redness. I don't see redness, and no swelling, and no drainage, and no settlement. The tympanic membrane is poorly gray, and the middle ear has no effusion. And I will do the same on this ear. I will pull it up and back, and I'll be checking the external auditory canal. I don't see any redness, no drainage, no swelling, and I don't see any settlement. The tympanic membrane is poorly gray, and there's no fluid or effusion on the middle ear. And both are intact. Next, I'll be palpating the pinna. Do you feel any pain? Any tenderness?
No.
And I don't feel any nodule. And the trachea, do you feel any pain?
No.
No pain. And I don't feel any nodule. Next, I will assess cranial nerve number 8, which is the acoustic nerve. And this, I will complete a whisper test. I will whisper 3 things. You tell me what you hear. And I'll cover my, can you?
1, 2, 3,
What's the other one?
5, 6, 7.
Good. Both hearing are intact. Next, I'll be checking the eye, the conjunctiva, and I'll put it down, and I see that it's pink and clear, and there's no drainage, and there's no lesion. You open your eyes, and I'm looking at the sclera, which is white and clear, and they are all both symmetrical and equal bilaterally. Next, I'll be assessing for the cranial nerve number 2, which is the optic nerve. And I will start by using my pocket snelling chart, and I'll have patient read from the smallest line while I move 6 feet away. Can you close one eye and read from the chart?
G, F, D, H, J.
Can you read from the other one?
G, F, D, H, J.
And you read from the both eyes.
C, F, D, H, J.
Good. Patient has 20/20 vision on the right eye, the left eye, and both eyes. Next, I'll be checking for peripheral vision. And I'll have patient stand up. And now I'll cut this. Okay, look straight on my face. And do you see my hand?
No,
Let me know when you see it.
no,
Look straight. Do you see my hand?
no,
Let me know when you see it.
no,
Do you see my hand?
no,
Let me know when you see it.
no.
Good. Patient has good peripheral vision, and they are both equal bilaterally and normal. Next, I'll be checking for the cranial nerve number 3. Cranial nerve number 3, which is the oculomotor nerve. And this, I'll be using my light source. I'll be checking for the purple response. Can you look straight in my eye? And I will use my light source and see how well the purple respond on one, and I will use my light source and see how well the purple respond, and they both respond normal, and I notice constriction 2 to 3 centimeters in diameter. And next, I'll be assessing for the cranial nerve number 3, which is the oculomotor nerve, cranial nerve number 4, which is the trochlea, and the cranial nerve number 6, which is the abducens. All together, they control the extraocular muscles of the eye. And I will start by making a H sign with my finger. Can you look at my nose? You move with your eyes while your straight is steady. Good. The oculomotor are all intact bilaterally, and I noticed extraocular movement of the cranial nerve number 3, cranial nerve number 4, and cranial nerve number 6. Next, I'll be assessing the nose, and I will check looking for any obvious fracture. I don't see any fracture. The nose is midline, and I don't see any swelling or any lesion. And I'll use my otoscope and look inside the nose. And I will tip the nose up and checking the left turbinate, and it's clear and pink and clear and moist. And I'll angle inwardly, checking the septum, which is not deviated and is straight line, and there's no bugginess, no swelling, and there's no deviation. It's pink and moist. I'll do the same thing on the other nose, tip it up, and I'll be checking for the left turbinate, and it's pink and clear and moist. And I'll be checking inwardly at the septum, which is not deviated, is midline, and there's no bugginess, no swelling, there's no drainage, and it's intact. Everything's normal. Next, I'll be checking the sinuses. This is the frontal sinus. Do you feel any pain?
No,
This is the maxillary sinus. Do you feel any pain?
no.
Patient does not have pain on the sinuses. Next, I'll be assessing the mouth. And I will look at patient's mouth, the lips, and it's pink and moist. And I'll be using my light source to assess the mouth, the inside. Can you open your mouth for me? And I'm looking at the teeth. There's no cracks and there's no decay. Open your mouth really well. And I'm looking at the buccal mucosa, which is healthy, pink and moist. And I'm looking at the soft and hard palate, which is healthy, pink and moist. Can you lift your tongue for me? And I'm looking at the floor of the mouth. There's no nodule, healthy, pink and moist. Can I look at your tongue? And I see the tongue is smooth and healthy, pink and moist. Can you open your mouth for me? And I see the inside, the posterior pharynx is healthy, pink and moist, and there's no postnasal drainage, and it's pink and healthy, moist. Thank you. Next, I'll be assessing for cranial nerve number 9, which is the glossopharyngeal. And for the purpose of this exam, we will not be testing that as the gag reflex. And I will be assessing the cranial nerve number 10, which is the vagus nerve. And I'll have patients say, ah, when I look at the uvula.
Ah.
And I see the uvula move up its soft palate and it's symmetrical with phonation. Thank you. Next, I'll be assessing for cranial nerve number 12, which is the hypoglossal. And I'll start by assessing the neck, checking this, make sure that I don't see any deformity and there's no lesion. And I'm assessing the trachea and it's midline, no nodule noted. You have pain? You have pain?
No.
And I'm assessing the thyroid gland. And to find the thyroid gland, I will use my hand to find the Krakow process, and the other hand to get the suprasternal notch. All together within that landmark, I'm gonna palpate and retract on one side and have patient swallow. And I see the thyroid move up and there's no nodule. I did not notice any nodule and it's normal in size. And I will do the other one. Can you swallow? And I see the thyroid move up normal and there's no nodule and it's normal in size. Next, I'll be checking the carotid, and I'll be checking on one side is normal and bounded and the other is normal and bounded. And I will auscultate for bruit. And I will use the bell of my stethoscope, and I'll have patients take a deep breath and hold it. Good, no bruit. And patient is holding it so that the sound does not disrupt the bruit sound. Take a deep breath and hold. Good. I did not hear any bruit. Next, I will complete the range of motion to the neck. I will have you tip your chin to chest. Up. Can you move left and right? Good. Patient has good range of motion. Next, I'll be checking I will continue with my cranial nerve assessment, and I'll have patient stick out your tongue, move it side by side, and there's no obvious restriction and there's no deviation. And I will assess the TMJ. Can you open and close your mouth? And I'm assessing for any subluxation, any tenderness, and any clicking. And I don't see any. Do you have any pain?
No.
Good. Next, I'll be assessing for cranial nerve number 11, which is the hypogloss, which is a spinal accessory. And I'll have patient shrug your shoulder. Good. Patient has good strength on the shoulder, and they are all appear equal bilaterally. And I will go ahead and auscultate for the heart sound. And I will first of all use my diaphragm and listen. And I will start listening, starting from the aortic valve, which is on the right to the second intercostal space to the right sternal border. The pulmonic valve is on the second intercostal space to the left sternal border. The os point is on the third intercostal space to the left sternal border. The tricuspid is on the fourth intercostal space to the left sternal border. The mitral valve is on the fifth intercostal space to the left sternal border, which is on the mid-clavicle. And I did not hear any abnormal heart sound, no murmurs. And I will go ahead and use the bell of my stethoscope to listen for brewing. And I'll start again on the listening, starting from the aortic valve on the second intercostal space to the right sternal border. Pulmonic valve, second intercostal space to the left sternal border. The os point, third intercostal space to the left sternal border. Tricuspid is on the fourth intercostal space to the left sternal border. And the mitral valve is on the fifth intercostal space to the left sternal border, which is the mid-clavicle. And I did not hear any probing. Next, I will assess the chest. And I'm looking for a contour and symmetry. Patient has good contour and good symmetry, and I can see the chest rise up and down with good air movement. And I will start auscultating for the lungs using the 6 areas. And I will start on the intercostal spaces. Can you take a breath with your mouth in and out? Good. Patient has good lung sound, normal lung sound, and clear lung sound to the anterior side of the lungs, and they are all clear bilaterally. Can you stand up? And I will be listening to the lung sound posteriorly using the 8 point areas. And I will start on above the scapula. Can you breathe with your mouth in and out? And I will be listening also to the medial aspect of the right lung. Good. All lung sounds clear bilaterally on the posterior area. Next, I'll be assessing the upper extremities, and I will start by checking the hand joint, and I don't see any deformity. I don't see any redness, no swelling, and I'll be checking for capillary refill. I will push down patient's hand and it turns white, and as I lift it, it returns to pink in less than 3 seconds. And I will do the same. I'll push down on the nail bed and release. It returns back to pink in less than 3 seconds. Patient has good and normal capillary refill. Next, I'll be checking for the radial pulses bilaterally, and I see that it's 2+ normal and intact bilaterally. Next, I'll be checking the hand strength. Can you squeeze my hand? And I see that it's tight, and patient has good strength, and it's 5 out of 5 on both hands bilaterally. Next, I'll be checking for range of motion to the elbow, and I will start by having patient flexion, extension, and I will check the strength of the elbow. Can you pull, push? Patient has good strength on both hands, on both upper extremities, and it's 5 out of 5. And for this, we'll be checking for passive range of motion to the shoulder, and normally this is done bilaterally, but for the purpose of this exam, we are doing it unilaterally. flexion, extension, internal rotation, external rotation, abduction, adduction. Patient has good range of motion on the hand. Next, I'll be doing cerebellar coordination. And now this is called rapid hand movement. I want you to use your finger and touch your thumbs, all of them. And I want you to do it faster. But cerebellar coordination is well coordinated bilaterally. Next is the rapid hand movement. I want you to flip-flop your hand back and forth on your thigh. I want you to do it faster. Good. It is well coordinated. Next, I'll be doing the deep tendon reflex check. Now, her patient's ankle and his hand, and I'll use the pointed side and put my thumb on the medial aspect here. And as I strike my thumb, I notice the fingers did constrict, and this is a normal finding. And with my flat side of the hammer, I will be striking on the this is the patella, and I'll be striking on the tendon here, and I notice normal respond. The Achilles, and I will move this a little bit, see how well you see that, and I'll be using the flat end of my hammer, and I'll be striking the Achilles, and I notice a pronation, and this is a normal finding. And next, I'll be doing the abdominal assessment. I'll have patient lay down. Can you lie down in bed? And I will move my camera to be able to see my assessment. Good. And I will start by inspecting patient's stomach, and I see that it is symmetrical and the contour is normal, and I don't see any redness, no lesion. And I will start by listening to the abdominal sound with my diaphragm. This is the left lower quadrant, left upper quadrant. I'll be doing this on all the quadrants. And I had normal bowel actions. Next, I will auscultate using the bell of my stethoscope. And this I'm doing to listen for brewing. And I will place my stethoscope below the xiphoid process, which is the midline, and the aorta. And this is the left renal, which is on the above and lateral to the left umbilicus. This is the right renal, which is above and lateral to the right umbilicus. And this is the iliac, which is on the right lower and lateral to the umbilicus. And this is the iliac, which is below and lateral to the left iliac. And I did not hear any brewing. Next, I will percuss on all 4 quadrants. And I'm checking for tympani, flatness, and dullness. And they all sound normal. I did not hear any dullness, flatness, or tympani. Next, I'll be palpating for any tenderness or masses using a circular motion. Do you feel any pain?
No.
Any pain on either side?
No.
Good. And next, I'll be assessing the spleen, the liver. And I'll anchor my hand behind, and I'll place my hand on the costovertebrae angle here. Costovertebrae angle, and I have you take a deep breath while I palpate. And I could feel the edge of the liver. And can you angle by the side? And I'm palpating, I'm assessing the liver, no, not too much. I put my hand behind and put my other hand at the costal vertebrae. And can you take a deep breath? Good. I do not feel the spleen, which is a normal finding. And next, I will, can you see that? No, not there. Next, I will check the lumbar sign, and I will position my hand at 90-degree angle, and I will push it. When I release it, do you feel any pain? No. Good. No. Any pain?
No.
Good. And this is a negative lumbar sign. There's no tenderness. Now, anchor my thing closer here. Next, I'll be checking for the lower extremities. I'll move it up a little bit. Next, I'll be checking for the lower extremities, and I'm inspecting for any redness, any swelling, and any nodule. I did not see any of that. And I come close, and I will complete range of motion to the hip. I'll do adduction, adduction. Internal rotation, external rotation. And next, I will complete the range of motion, and both normally this is done bilaterally, but for the purpose of this exam, we're doing it unilaterally. And patient has good range of motion, good passive range of motion to his hip. The next is the knee. I will complete flexion, extension. And I will check the strength of the knee. Can you flex? Can you flex? And can you pull my hand? Can you push? Good. Patient has good strength on his bilateral leg, and is 5 out of 5. And I'll be checking for range of motion to the ankle. And I'm doing dorsiflexion. Let me move it closer. Dorsiflexion, plantarflexion, and rotation. And I'll be checking for the. Can you pull with resistance? The patient has good resistance. Does it resistance? And can you push? And this is plantar resistance, and it's 5 out of 5 on both. Next, I'll be checking for dorsal pulses, and this is right here, and it's 2+ bilaterally normal. And I'll have patients sit up. And the next will be the spinal exam. And I'll have patients stand up. And first, I will start palpating and inspecting the spinal for any misalignment, any curvature, and tenderness. Do you have any pain?
No.
Okay, I see that it's not misaligned, it's straight, and there's no tenderness. Can you turn around? I want you to, we would complete spinal range of motion. Can you bend and touch your toes? Good. Up and flex. Good. Patient has good range of motion to his spine. Can you move side by side? And can you move your head on? Can you flex to your right and to your left? Good. Next, I'll be completing the rumble sign, the rumble test, which is I'll ask patient to close his eyes. Close your eyes, and I'm checking for any swaying while I make sure patient is safe. And I did not see patient swaying. Open your eyes. And I will check for gait. Back a little. Can you walk up a little bit to the camera while I assess your gait? Can you turn around and walk back? Good. I did not see patient Patient has good gait. He was able to move back and forward, and this is the end of physical assessment for NR 509. Thank you.